Hello, I'm Carrie Weber, Chief Communications Officer and owner of the Jameson Group, where we help dentists and teams become more productive, more profitable, and ultimately more fulfilled in their practicing lives. We have the privilege of working with dentists all over the United States and helping them become more productive and more profitable in their dental businesses. And it's often a pleasure of mine to have the opportunity to learn from those dentists on their success stories and their successful careers. Our founder, Dr. Kathy Jameson, built all Jameson systems through her husband's practice, Dr. John Jameson. And between Dr. John Jameson and our clients and friends, we develop and continue to enhance systems that help your patients say yes to treatment. Two of my most favorite dentists, Dr. Jameson and Dr. Mark Hyman, shared with me key tools that I wanted to share with you today, and what I consider are sacred time, sacred tools, and sacred places to help patients say yes to larger cases. As Dr. Jameson says, those sacred conversations are very important. Mastery of verbal skills are going to help you help your patients understand the value and the trust of the treatment you're presenting, especially if there are large fees connected to that treatment, to help them overcome that emotional obstacle of how they can possibly afford to say yes. So to have the communication skills in the patients and sacred time, as Dr. Mark Hyman would say, to have important conversations, to connect in a relationship with your patients and give them the space to emotionally work through how to make that treatment a reality in their lives. He uses sacred time when he speaks about the new patient experience and how he takes time out of his busy day and his very productive schedule to truly sit down and communicate, get to know the patient, listen to the patient, and understand their goals for their mouth, their teeth, and their smile. He considers it sacred because while it may be difficult for doctors to consider taking that productive time out in the hope that a new patient will move forward with treatment that they need, he truly understands the value pays itself off multifold, and not just helping a patient say yes to large treatment cases, but also to solidify them in the relationship of their patient family, and it solidifies longevity. So not only are they coming in for that one appointment, they return again and again and again for customer loyalty. Sacred time. Consider blocking that time for a new patient so that you can truly develop a relationship of trust, so they understand not only the treatment diagnosed, but that you are there to sit with them and take them all the way to the end to help them find a way to make it a reality in their lives. Sacred tools. Both Dr. Jameson and Dr. Hyman, if they were sitting with me today, right here with you, would tell you intraoral cameras and technology in your practice that can help patients visually see what's going on in their mouth is so powerful, and it is non-negotiable that intraoral cameras are provided for each provider in a practice, be it dentists and hygienists, and you're using them on every patient to show them what's going on in their mouths, especially dentistry that is diagnosed and untreated. It supports the doctor's diagnoses, and the team can then elevate themselves in assisting in case acceptance. And a hygienist especially can become an incredible teammate for a doctor in supporting diagnosed treatment, helping them understand the benefits of moving forward with the treatment, helping patients see the risks of not moving forward with the treatment, and then showing them and supporting with before and after photos, because we know as a society that we are 63% of us visual learners. Tell me and I might believe you, but show me and I can see it for myself. Sacred tools to help you say yes to treatment. Sacred places. When I speak to this, I'm saying when you have big cases, there's a lot of elements involved in that case presentation and that communication that has nothing to do with the treatment you're presenting. It has to do with me, your patient. You are talking about very sacred and very intimate parts of my life and my body, my mouth and my pocketbook. So do you have a reserved space in your practice for private consultations where I can have emotional time to listen to what you're having to say, figure out for myself what I need to do, work with you and your treatment or financial coordinator on how to make this a possibility through your financial partners and options? This is a time and a space that makes it more comfortable and safe for me to have conversations with you as my healthcare provider on the best steps forward for a large case that you're presenting to me. Sacred space. So as I said, sacred time, sacred space, sacred tools. Consider looking over your practice and the systems that you have. How can you make these more important and a priority in how you take care of your patients so that they can ultimately say yes to the treatment you're providing?